Good morning, it's 11 a.m. on May 9th, and I call to order the Lake County Board of Health. Commissioner Lee is out, but we still have a quorum here with myself and Elsa. And the first item on the agenda is the appointment of Kelsey Maxey as Director of Lake County Public Health Agency. Our current Director, Julie, is stepping down as Director, and we would like to start by sending her a note of gratitude for all her work and leadership in her time as Director of Public Health. And we wish her the best in her next adventure. Kelsey has been Deputy Director of Public Health for some time and has stepped up numerous times to be Interim Director. She comes with a great deal of knowledge and expertise, and we're lucky to have her leading the Public Health Agency in Lake County. Kelsey, would you like to say anything?
Yeah, I just wanna thank you all for this opportunity. This isn't really how I saw my career going, but I'm really grateful to be here, and I was just kind of thinking back on how I'm gonna show up differently than I have been over the past 2 years. And I think the main difference is I was always leaving space for a leader. And I'm looking forward to really taking up that space as the leader, and guiding this team and working with you all, and you, Lisa, to make public health what this community needs. So thank you.
Thank you.
Thank you so much, Kelsey. We're very grateful for you. We know you're very capable, you've done it before. And I really love that goal of yours. I think that's fabulous, and you don't hear that often from women in leadership to take up more space. It's very courageous.
Thanks.
Yeah.
Would you like to make a motion?
Do we have to appoint her? I move to appoint Kelsey Maxey as our Director of Public Health.
I will second the motion and take a vote.
Aye.
Aye. Kelsey Maxey,
Yay, Kelsey!
Thanks.
duly appointed.
Mazel tov, yes.
I will now pass it over to Kelsey Maxey, Director of Public Health, to provide updates to the board.
Okay, well, first, thank you. And I wish that I had like more exciting updates to dive right into, but that's just not the time that we're operating in right now. So the first update is I just spent 2 days at the Public Health Executive Directors Summit in Denver, with all the public health directors from the state, which was really amazing. And we had a lot of talks about funding and what that looks like, which is mainly no one actually knows what it looks like, except it's not looking great. There's so many unknowns. So kind of business as usual until it's not. But a direction that we did get is that we locally need to be able to turn around our funding contracts a lot faster than we did in the past, because the funding is coming down later than it normally would. Like normally we'd be doing all of this right now, and like the state hasn't even gotten the funding to like pass it through to us yet. So there's questions around like, will it get passed through? Hopefully still yes, but maybe not. And when it does, it's gonna be a quicker turnaround time because the fiscal year that the state operates on starts July 1. So just wanted to express that to this group, that normally when we could probably take a couple weeks to turn something around, we're probably looking at like a few days to get things signed and get them back in. So I think that has maybe been made easier with Candace being able to sign some things, is that right? Okay. Is there anything else that we need to understand about that change and how it impacts this, Candace?
I don't think so. Essentially, I'm able to sign anything 25,000 or less, and then it comes up on the consent agenda. If it needs to be reviewed by legal, I of course do that before I sign.
Okay.
And then if they have any questions, they're able to ask me or pull it off to have a deeper discussion.
And if it's more than 25,000, how would we address that?
In that, didn't it also include like year-over-year contracts? So if
Okay.
they're normal contracts that you have from.
Your regular recurring
Yes,
are fine.
great,
Sorry.
okay.
Then she-
Yeah,
thank
we're
you.
not, well, unfortunately, we don't have any large new funding sources coming in, so they should all be pretty business as usual. Okay, great, thank you. I just wanted to discuss that briefly and make sure that as a group we were prepared to tackle that. I would also be remiss not to just talk about the measles briefly. We haven't seen outbreaks spreading through Colorado. On our state call, they think it's ultimately being a little bit underreported, but that also means that people aren't in the hospital with measles in Colorado, so it is still a good sign. But we've had 5 cases in Colorado, so it's something that we're still just very, we're ready to spring into action at a moment's notice if and when we get a case or an outbreak that somehow impacts Lake County. Just so you all know, we have a communicable disease nurse who works part-time. Is getting a lot of education about communicable disease, but the moment that we have something, she's trained and ready to kind of handle that and do the contact tracing and do that. An outbreak would require state support for us.
And we're ready at the
yeah.
hospital as well. All the physicians have been educated on what to do, we all know the hotline numbers, we know the reportability of measles, and so we're ready to.
Great, thank you. Lisa, you've been a great partner in that. And that is something too that while we have less resources, I think as a group, we are more prepared for something like that because it's easier for all of us to get on the same page.
Yeah.
Other counties that we're expressing like outliers and medical providers who aren't testing for the measles or who aren't willing to participate in these things, so I think we're really fortunate to have medical providers that are willing to engage.
Well, then we're also well connected.
Yeah. Mhm.
How do measles, how do they present, how do they show up?
Hi.
Red bumps?
High fever,
High fever?
so 104, 105 is not uncommon. Mostly in the unvaccinated, one vaccine for measles, 95% efficacy, 2 vaccines for measles, 98%. You get your first measles vaccination at 12 months, your second one somewhere between 4 and 6, and that's a lifetime immunity. For those of us who were born before 1971, before the current MMR was available, they are recommending that you get a booster vaccine, just to make sure if you have any idea that you didn't get the current vaccine. You can also get titers from your primary care provider as well, so you can just be tested to see if you have immunity. Getting back to the question though, so high fever, the rash starts on the face and then just kind of migrates down to the rest of the body. Cough is usually a presenting factor. The big one is meningitis or encephalitis, which any viral illness can get you to, but that's what people die from.
So an outbreak would mean if it was a child or something, we'd just try and quarantine.
Just like COVID, right, any other viral illness, so presenting into the emergency room, so if we see someone who we suspect, we put them in our negative air pressure room, sequester them, admit them, and then take care of the testing. The testing currently has to go to the state, so there's a courier that will take that down, but there's usually 48, 72-hour delay in diagnosis, so we just treat them. There unfortunately is no true treatment other than supportive care.
And then a lot of public health's role in that is to be like, okay, who has potentially been exposed? Are they in the window where we can still vaccinate them if they're not vaccinated, or do the the PEP, post-exposure prophylaxis? And so that's kind of where we jump in, is like, how can we protect the other people that have been exposed by this, and like, where can we step in to prevent future illness? So we have good communication and a good plan. A lot of measles cases would be challenging for Lake County, so hopefully we don't get there.
Well, unfortunately, our vaccine rate is still relatively high for the people that we know of, so we're protected from multiple people who are vaccinated. All of your healthcare providers, for example, are vaccinated, so we won't get sick.
Yeah, and the whole staff at St. Vincent's did just do titer checks to make sure all of their immunity is still at a high level, and some of them had declined a bit, so they got revaccinated, and that's, so.
Which is fine. And again, those of us who were born before 71, just popped in and got another vaccine.
What's a titer check?
So it's a blood test
Okay.
to look at your antibodies, and so you should have memory antibodies, IgGs, from the vaccine that you had whenever you had it at 12 months and then at 4 to 6 years.
Wow,
Yeah, in your body, we can detect that.
after all these years.
After all these years, our bodies are smart.
Wow,
And
safe
so
and
if-
effective vaccine.
If your titers are low, then you just get another vaccine. So there are often people who just say, I'll just get the vaccine, because it's a lot easier and less expensive.
It's pretty wild to have like gone through COVID and I literally understand the things you're saying. Whereas like 5 years ago, I would have been like, what are you talking about? Like, okay, I believe you, I trust you, please continue to do your job. And I'm like, oh yeah, no, that
Very
makes
savvy.
sense, good job us.
Yeah.
It's really wild. Thank you, Kelsey.
Yeah, any other questions about that?
So the booster is just for measles, is it for MMR?
It's an MMR. So you would talk to your primary care provider, you can get the MMR in 3 locations in Lake County, the Public Health Department, of course, and they'll do walk-in vaccinations when they have staff Monday through Thursday. Yeah.
Some Fridays.
Safeway, anytime the pharmacy is open, they can do that as well, and you can also walk in. And then St. Vincent Health, through their primary care center, can do the vaccination for both adults, and everyone can do adults and children.
And is that a traditional vaccine, like an attenuated vaccine, or is it only?
It's a live vaccine.
It's a live vaccine?
Yeah.
Okay.
If you have not been exposed to measles recently, you have no reaction. So, thinking that there's no measles here yet, most everyone who gets the vaccine won't even notice.
Okay. We'll keep you here all day with questions, so continue.
Yeah, thanks for being here to really
I am always available.
deeply answer those questions.
Everybody has my cell phone number, you just blow it up.
And I do, when needed for sure. Great, I wanted to also give you all an update on our community health assessment, which will ultimately lead into our improvement plan. As has been discussed previously, this is required a statutory requirement for public health to do once every 5 years, so this is our year to do it. We had our advisory committee meet on April 3rd, and we had a great attendance in that. We had so many community partners there. It was really exciting and amazing. And basically what we did is, because we have folks representing what we truly believe is the different pockets in our community to try to get that whole community representation there, is we all went through an activity to identify like what we're seeing in our areas of being the biggest issues for our community. And the kind of big takeaways that we all came up with were healthcare access and costs, affordable housing and homelessness, or other things. A lot of things fit into that definition, right? Like a certain amount of people living in a home as people experiencing homelessness, and anyways, there's a lot that goes into that. Access to mental health support, cultural barriers, divide and language barriers, substance use and addiction treatment, food access, and then federal and state funding and policy changes that could severely impact the existing services in Lake County. So we are gonna kind of formally put all of that together, and then that kind of turns into our assessment of like, where are the areas that our community needs the most support? What program currently exists, not just in public health, but in a nonprofit in Lake County, or who's tackling this issue in the community? And if nobody is, wow, we need to like figure out who's the best agency or organization to do that work. And then once we've assessed all of that, then we move into the improvement plan, which will kind of take us into 2026. And we do have a contractor that's doing a lot of the background work on this for us, which is great. I got a mini grant that is paying him for that. I really hope that grant opportunity is available again in the fall, so that we can continue to pay him to do that. Because while we can do a lot of the community work, a lot of the data collection and putting that together in a way that that makes sense is really his expertise, and that's something that we have in-house. So, do you guys have any questions about that?
Yeah, I'm gonna give an example,
Okay.
and then you help me understand where this fits in.
Great.
If we could go that way. So when we were at our CCI conference, which was like freshman commissioners getting trained, that's when the city council had the hearing for the emergency shelter. And I called Tim and I was like, hey, is our public health going to show up to advocate for this? Because we know this is an issue. And he said, because we as a Board of Health had not been seated yet and had not established that as one of our priorities, it wasn't appropriate for public health to be showing up in that way, having not had direction from the Board of Health. So I was just wondering, does this establish priorities from the board so that you all can go out and advocate in situations like that? Or when, this feels like it would inform it, that we could say, yes, do those things, please. When does that happen?
Can one of you maybe help me answer that question? I received direction not to talk about that, so I wonder how that changes and at what point there is.
I think there's a level of like, comfortability of staff too, to advocate, you know, like not forcing staff to go to meetings to advocate if they didn't want to.
Mhm.
But certainly because we were in between boards, not having that direction was challenging. Yeah, I don't know, Candace or Chris, do you wanna add anything else?
When does the Board of Health establish the priorities then of what is happening in the community and how we're showing up for them?
I haven't been a part of that before.
Yeah,
So
this
this
is
is a good question and I think
yeah.
discussion for the group. I think it's a really important
Stop
question,
looking at me.
Elsa. Yeah.
What you think, Kelsey?
No, you can look at me, but I don't like.
Kelsey, what do we do?
answer.
So in years past, we've
Thank you,
done, you know,
Lisa.
yeah, we've done this every 5 years for decades.
Yeah.
So in years past, we as your public health department came up with our recommendations.
Mhm.
And so we went through this process, right? So we identified the players in town, we got their thoughts and feelings. We never used a consultant before, so I don't know how that kind of works. But then when we have our plan, when we know as a public health department what we think we need to focus on, then we bring it to this meeting.
Mhm.
And then you as county commissioners, you know, put in your input, and then we came back with a formal plan.
Okay,
But the Board of Health was not involved until we had something to show you.
yeah, okay. So you're showing us the seed of this plan that won't come out until 2026.
Mhm.
And between now and then, if something in the community comes up, like say, some great, I don't know, like treatment facility is proposed, would the public health department come to the Board of Health to say, can we show up in this way? Do they wait? Does public health wait to engage in that?
In the past, we have waited.
Yeah,
So,
okay.
you know, we wanted to have a concise plan for, you know, what we wanted to present as, you know, to the Board of Health. But, you know, that's in the past, right? We can always do something else.
Okay.
But I think that this is such an enormous project. There are so many things that need to be serviced that we're never gonna be able to satisfy all of them.
For sure.
That's why we initially bring in all of the players. And then as the meetings progress, those kind of, it dwindles right into the core people who really have something to add to the project.
Mhm.
And then we present the project. And you know, sometimes, you know, the Board of Health goes, that's not what we wanna do at all. So let's add these, you know, pieces to it, knowing that there are some other things that need to be addressed in our community. But I think that's premature.
Well, and if we do, and please correct me if I misspeak here, I imagine if we call something out in the improvement plan that is adopted by the Board of Health, if we're like, public health will advocate for other entities who are supporting this goal or something like that, then we could maybe tie in some type of advocacy for another organization to take on this work, or is already doing the work.
Yeah.
Right, like our goal is not to take over the work when
Right.
someone else is already doing it.
Right.
But find the channel to support it.
Right.
Does that sound
That
right?
makes sense.
Okay. And I would love to tie that in here because I think when public health publicly supports something, I think it makes a difference.
It really makes a
And I
huge
want us
difference.
to continue to make a difference in that way.
Yeah.
And support the important organizations that we have
Mhm.
here that are helping tackle public health issues. Like we are very much not doing this alone, so.
For sure.
And it's very important too, you know, because we're all strapped for resources, that we don't duplicate services.
Yes.
Yeah.
And this is the process that allows us to do that every 5 years, is to find out who's doing what. So that we can again support one another, not duplicate
Yes.
and waste resource.
I think there's varying degrees of advocacy too,
Mhm.
you know, like going before the city council with an ordinance and like a formal vote is a lot more public, and I think we wanna make sure that we're in line with the Board of Health. But like a lower degree of just like talking to community partners, like telling them what we're seeing in public health as far as homelessness or substance use or whatnot is a lower degree that I would feel more comfortable with public health doing just as experts in the field. But as you get more public, I guess, wanting to make sure you're in line with the Board of Health.
Yeah, for sure.
answer your question?
Little bit, we'll see how it goes.
Okay, but I would like to move in that direction also, I think that.
Just as somebody who, as a decision maker, I appreciate when multiple entities show up to help me understand
Mhm.
how important or myriad, an issue is. So I just wanna know how we can show up through public health to tackle any of these things and what you need from us as the Board of Health to impel, encourage, advocate, or like make sure there's structure for you to do that.
Thank you for that support.
Yeah.
And I think we can all navigate and use the Board of Health to make sure that we are structuring it in that way, right? Because we have to do certain things as the Board of Health, we have to meet, we have to do the training, but then at the end of the day, we're the humans sitting in here, so we can direct how a lot of that works. So I'd love to work with you all to make sure that it is like producing the vision that we would all like to see.
Awesome, let's go.
Yeah, okay.
Thank you.
Any other thoughts or questions about the assessment and future improvement plan? Great, I'm really excited. A lot of these things are issues that we saw in the last one, right? Like nothing, like housing is not new, some of these other things are not new, but I'm glad to see that we are talking about substance use, food access, and some of these other things like on a higher level. Cause we're really seeing how those things lead into domestic violence and other issues, right? Like if we can work in the preventative area of some of these and support people in these areas, I think we're gonna see less of other things in our community. So that's exciting. It's like hard to see these as our issues, but also exciting because we're gonna work on them. That's great. Excellent. I also just wanted to give a brief update on blood lead testing. So that was one of our goals that we called out for 2025 is just to see an increase in blood lead testing. With COVID, we saw a great decrease in blood lead testing because folks were not doing things in person, and that is not something you can do virtually. And we are on a really excellent track. 2024 was a wacky year for many reasons, but we did 86 blood lead tests total in 2024, and we're already at 56 for this year, so that feels.
Newborns, right? Or everybody?
No, everybody, but not newborns, we're starting at 1 is when we test for blood lead. But also pregnant, our main group that we're looking at here is children ages 1 to 6, pregnant and nursing people. And then we also will test adults who are concerned, but really lead is most impactful when the brain is developing, so that's why we have that core group, but we also have adults that are concerned about their lead levels in Lake County, and we don't turn anyone away, so.
The birth rate of Lake County, 120 births?
I don't know the answer to that.
So somewhere usually between 100 and 120 births per year. So if you are up to 50, you think most of them were children, that's extraordinary.
It's almost all children, so we went to Bright Start, and I believe we got every single kid at Bright Start tested while we were there, which is really exciting. This has been a new way that we've been approaching this outreach is we send all the paperwork out ahead of time, and then we test the kids while they're at school.
Yeah.
And if parents want to join us, they are welcome to, but honestly, the peer support of 4-year-olds is very beautiful, and they really they really get each other through some tricky things. My son did somehow get Ashley to start giving everyone 3 toys, I'm not sure, but
Wow.
he was like, I know these people, and then she'll give us more toys. He was right. So that's really exciting, and historically, we have done outreach at school events, but we would get like 3 to 5 people, and we targeted it a little bit differently this year. So we went to parent-teacher conferences, and Ashley set up in the nursing office in the center. And then whenever a kid would check in for their conference, they had them fill out blood lead paperwork, if they were willing. Obviously, we're not forcing people to do this, but providing that education of why we should be. And then kids who are in Head Start are required to have their blood lead tested. So this removes those barriers, they're already there. And we got almost all the preschoolers tested in that round as well. So we're gonna keep doing that, and hopefully it just becomes more the norm of that expectation of, hey, we're gonna go to parent-teacher conferences and you're gonna get your finger poked. right?
That's all it is, a finger poke.
It's just a finger poke, yep.
And interestingly enough, although we live in Leadville, the amount of lead poisoning here is still very small. It's consistent with the state's averages. And it comes from exposures in the home mostly, which is lead-based paint, unfortunately. It's our old houses. There's very little lead in the ground, even though we are in Leadville.
And a lot of folks are like, I wanna get my yard mitigated and fixed, and that's really expensive, and it's not like a sure thing, because then the snow melts and all new things come back, right? So we've really focused, and a lot of this predates my time at public health, but on the prevention and education aspect of like, there's really simple things that families can do to reduce lead exposure.
Mhm.
And I think as we've done that over more than the past decade, do you know when that started?
We started doing mitigation with who was the federal government was here doing
The
mine,
EPA.
yes, thank you, in the 1990s.
So this has been like a long journey, and really what we're seeing is not a lot of elevated kids. And when they are elevated, it's a low level of elevation that we're able to see decrease by like increased hand washing and like wiping down dust out of the home and talking about like flaking paint and like water testing. So it's that's really exciting to see success in this area after like a pretty deep dive through the pandemic.
And remember that lead poisoning really means nothing for adults. There's no clinical relevance at all. It's really children with growing brains. And so it's that year to 4 or 5 is when it's really critical.
Unless you're developing the brain in your body.
Unless you're
Right.
pregnant.
Yes.
Another way to say that, Lisa, yes, thank you.
Absolutely. You are absolutely correct. Or you're breastfeeding someone
Right.
who is in that age group.
So if a child has an elevated level, you guys follow up, go to that, say, can we come to the house and look at your house and test your.
Yeah, and some of that has shifted over the past year where the state now has home investigators who have a lot more tools than we have. But we have not had to do a lot of home investigations in the past few years. There was a really heavy run of that, and a lot of things I think, and through education, it's just hasn't been as necessary, but that resource is there. If we have a kiddo, we like do small interventions and then we test them again in a couple months to see where they're at, and if they're moving in the right direction, we keep on that. But if they're not coming down or they've gone up, then we absolutely move to a home investigation, and then there are funds if we need to do remediation. We have funds in the trust to pay for that for the family. It's can get super expensive and then a little complicated, especially in these older homes, right? Because once you take apart one thing, then like it's like the domino effect of so the goal is not to like fully remodel someone's home, but just remove the exposure.
And remember too that it is, the initial screening is a finger poke, and so if you're playing, with a dog who has just rolled through paint, right? You're gonna have some on your hands, doesn't necessarily mean your level is elevated. So it's always backed up by a venipuncture that is done by the primary care provider.
Other questions? All my updates are really shifting gears, so now we're gonna talk about tobacco retail licensing. So the previous board, and in correlation with city council, we approved a tobacco retail license in Lake County. The reasoning behind that is that our Healthy Kids Colorado data shows us that kids in Lake County are able to purchase tobacco from a tobacco retailer. They are not finding some like secret way to get tobacco, they are walking into our stores and buying it and then leaving. So,
And that includes vape juice.
yes, tobacco is like an umbrella term for any nicotine containing product. So yeah, chew, all of these things are like umbrella under that. So we have a tobacco grant, so we worked to get an ordinance passed so that we can regulate this on a local level. The state does tobacco retail licensing. They don't make it to Leadville very often. Their enforcement here is ineffective. So regulating it on a local level also allowed us to take it up a few notches. We have a cap for how many tobacco retailers can exist in the county and in the city. And then we also have added other layers of things that they cannot sell and regulate how they can sell things so that it is not like promoting more tobacco use to minors in our community. Happy to dive into any of that more. but it took a while to get everybody licensed. Folks, as you can imagine, weren't super excited about paying us for a license and entering into more regulation, but we did get everybody licensed. And then we did our first soft compliance checks, which we chose to do all as educational based, so we're not enforcing any fines, no fees, like no suspended licenses, because we wanna be a partner with our retailers in this, so that they see us as someone to work with and not someone to work against. And unsurprisingly, all but one of them require us to come back to, right, cause we have some things to work on. Which really shows us like the work that is required in this realm, cause we're not seeing violations just on our local ordinance level, we're seeing retailers that are violating federal laws as well. So we go in and we go through what we require in our local ordinance, then we check what the state requires, and then we check what the federal government requires, and we're seeing violations in all three of those areas. So we are gonna recheck everyone in the next couple months, we're giving them some time to comply, to ask questions, to work with us. And then, yeah, so we're pretty excited about that, it has been quite an undertaking. Our food inspector, Alana, has been doing this. But I went out with her to make sure she felt supported, and so that there's not only one person in Lake County who understands how this program works. And it was just wildly interesting, the amount of vape options that there are is terrifying. And then we're also seeing a lot of kratom, which is an unregulated substance that kind of acts in the body similarly to an opioid. So we're seeing unregulated products that are available in our stores, and it's not illegal to sell them, right? So we can maybe help advocate for some regulation around those things. Cause we know if minors are getting access to tobacco, they're probably also getting access to kratom and to psychedelics that are being, sold and things like that. So it's kind of a beast, but we are excited to start chipping away at some of that to ultimately protect the youth here. And then another part of this program is running underage compliance checks. So our plan with that is we are working with HR to utilize the high school interns that work for the county in the summer. And we're gonna have them sign up to run underage compliance checks with us, which is basically where we send them in. It's more complicated than this, with some money, and they try to buy tobacco with their ID that shows that they're 16 or 17 or whatever that may be. And if they can purchase tobacco, then we will ultimately then go in and work with the retailer on that. There are some pretty intense fines and license suspensions for that. So that's kind of our next step in that program. Do you guys have any questions? That was a lot.
Safety issues for you
Yeah.
guys, and I can imagine that there are some store owners that obviously won't be so happy with this information. Do you ever feel like you need law enforcement support?
We haven't yet. And the goal to keep the underage compliance checks safe is that we wouldn't immediately go in if they do sell to the minor, cause one, we wanna protect the minor, we don't want the store to be like, that's the kid. So we're working with the state on seeing how other people do that, but it sounds like they typically then serve the notice the next day. So that you don't know who the kid was, we have all the information, we'll have pictures, we have a whole way to document everything. But to protect the minors who are running this
So
for
you're
us.
following state guidelines, because
Yes.
we've done this before.
Yeah.
Okay, great.
It's a great question. In other places, the sheriff's offices are the ones who run these underage compliance checks. Obviously, that's the ideal situation, but Lake County is not in a spot where that is something that can currently be done at that level. So we have it written into our ordinance that we will manage that portion of this program.
I have a comment, my kids tell me that everybody at school vapes, and that they disable the detector in the bathroom, and when they go to the bathroom, it's just packed with all the kids vaping, probably marijuana as well as tobacco. Are you guys working with the school at all, or is there any way to?
We would love to increase our partnership with the school, and I think that we are on track to continue to move in that direction. Has been a challenge to get in there when our schools obviously have a lot of other issues that they're trying to work out, and getting that to be a priority. It hasn't made it yet, but it is, we will not quit trying.
The other partnership is with the Elevate Health, they have the school-based health system. And they would, excellent partners to be able to do that, and so I think as they're figuring out their staffing issues for Lake County, that's just another avenue that we'll ask for help for.
Yeah, but ultimately with a lot of our work in tobacco prevention and in like harm reduction and lifelong like use of substances and opiates, we would love to get some more of our education from public health into our schools. And we are having those conversations, and I think that we will get in there. I think it just will take some time.
There's a misconception is it a misconception that that's safer than a cigarette?
It's not,
It's
it's worse,
sucking on a battery?
it's worse.
There's a really,
You're inhaling gasoline, it's a petroleum product.
It's not just the vapor.
Well, it's a lipid-based tincture that goes in there, so they suspend whatever drug it is, either nicotine or THC or, whatever, fentanyl, in a lipid-based solvent, and that's inhaled into the lungs. And so when you're inhaling burning organic material, that's one set of things, like a cigarette. But the vape cartridges clearly induce lung disease sooner. And there is a whole new ICD-10 diagnosis of vape-related lung disease that we almost always see in young people now.
there's an amazing documentary called Big Vape on Netflix.
Oh, yeah.
And it talks about the like inception of Juul, like the original vape pen, and how it was,
Sold to us.
the hope was that it was actually going to be a way to deliver nicotine without the chronic effects. But then of course, you wanna make money on your product, and it went from like potentially being a prescription to being a commercial product. And now we have vape, but it's a really interesting documentary if you're curious about the beginning of. But that's where that misconception comes from, is cause that was the intention in the beginning. About the kratom, if it's not regulated, then is it something that they actually have to check an ID for?
Yes, so in Colorado, you do have to at least be 21 to buy kratom, but the unregulated portion of it is like, how much kratom is it in each thing, right? Cause they're gonna tell you it's however many milligrams, but
There's
who's
no
checking
regulation.
that? There's no
Right.
regulation,
Okay.
right? On the actual product itself,
Okay.
to, not guarantee, but there's no level of safe,
Oversight.
or oversight.
Isn't that true for THC though as well, when you go buy an edible, for example, and it says that there's a 40 milligram dose, there's no one that regulates that, so you don't know that it's really 40 milligrams.
I don't know the answer to that
Yeah, we
question.
have had this discussion amongst the commissioners and city council many years ago when marijuana was legalized, about who's gonna regulate that, and we decided that is something we just can't do, because it's such an enormous project. And there's no one from the state or the feds, that regulate that either, so you go and buy your marijuana brown and it says there's 40 milligrams in there, good luck, who knows?
And we don't have like farm to table cannabis in this town, so it's not like we could locally regulate production.
Right, but even every leaf is different, right?
Right,
It's,
yeah.
it's-
Yeah.
At least in tobacco, we know, how much nicotine is per product. But
There's local retailers selling kratom?
Yes,
a lot.
Of the 13, how many?
at least 4. It was in almost every retailer I went in when I went on the checks with Alana.
But you can also get it online too, so.
Absolutely.
I like the approach of like educating first. Sounds really in line with how the state health department shifted in the last 10 years. Is the state setting that tone of going in and being education? Are you all just taking that lovely tactic and applying it?
That's all Kelsey.
I love that. Love
I
it a
took
lot.
lessons learned from retail food and applied them into this.
Yeah, girl, they worked. They worked. Cool.
But also the state was like, yeah, this is your ordinance and
Yeah.
you get to choose how you enforce it, and what we've learned is that you are an ineffective regulator if you do not have a good relationship. So we are trying to develop that relationship, and obviously every retailer is different in retail food and in this, right? Like some people are uninterested in us regardless of how we approach them. But a lot of people we have really excellent relationships with, and it is teamwork versus like us being regulators. So yeah, that's been our approach, and I'm really hopeful that it leads to enforcement with very few violations. And let me tell you, I don't wanna charge someone $1,000, I have no desire to.
You want them to just do it.
I would like them to just do it.
Yeah. Have you, are there other surrounding counties who have their own tobacco local ordinances as well?
Yeah, and Alana went out and shadowed them before we started
cool.
ours, so she went on inspections with them. And then a lot of our ordinances mirrored off of other ordinances in Colorado counties. We did level up a lot of things. We have one of the highest level tobacco retail ordinances in the state of Colorado,
Cool.
Which is pretty cool.
Are there other surrounding counties we could trade interns with? Just so you're not working in your own community
We could
to do this regulation?
we could work with HR and consider that, yes.
Just an
Yeah.
idea.
Yeah, it sounds like in other places they struggle to find the young people who would like to do this work, so it sounds like often like it is the children of the sheriff or, you know,
You think that'd be cool
I know,
to
and
go
we're
undercover?
gonna like give them, like we're gonna buy them lunch and like give them a gift card.
Yeah.
Like it's pretty sweet.
But you're also
Tell me
cutting
as a
off,
16-year-old.
you know, you're cutting off your buddy's supply chain, which
Yeah,
makes you
yeah.
unpopular.
Right.
Which is why it'd be cool to work in a different county.
Yeah.
Yeah. Interesting, thank you so much, Kelsey.
Any other questions? I know you all were not along the ride for that process, so if you do have questions along the way, it was like a very deep process and there's a lot of things that we haven't talked about, so if you have questions or thoughts, please let me know.
What's an example of a federal violation? There's a lot of federal violations.
Yeah, advertising for vape, like e-cigarette products on the outside of your building.
No kidding.
So like for advertising for a certain brand, because there are only like 4 vapes that are FDA authorized. And the amount of vape products out there is insane, but the federal government is not regulating that well, like they're not enforcing their own regulation on that, but so yeah, you shouldn't have like Geek Bar sold here on the outside of your business, so we're getting
There's, you know, like distance from an elementary school or
that's not federal though.
that's.
Yeah, and then we leveled it up, yeah. But yeah, that was the biggest one we saw. The other federal ones are like, you can't sell cigarettes in a vending machine, and like, it's mostly, it's funny, cause we have to ask about that, and people are like, do people do that? Can we have one? I'm like, no, we cannot do that.
Louisiana, you can.
Back to the 50s and 60s.
I know,
Yeah.
we totally did that, what are you doing?
Bought them out of a vending machine.
Yeah.
My old life.
Yeah, so we're seeing less violations in the federal realm, but we are seeing mostly that one.
Okay.
Cool. Well, if you don't have any other questions, I will hand it over to you.
We got our new,
Put you on the spot, Ann.
our new email situation verified. So just wanted to mention to you that we have 2 more variances coming in on the OWTS permitting. And so and just give you an update, next week, Kelsey's gonna join us for our selection committee. We've got some applicants for the OWTS position that we're going to be interviewing, so hopefully we'll have somebody selected soon and we'll have them on board and start the training with the state. So we have no one that has applied, some of them do have public health backgrounds, but none of them currently have worked in OWTS before. But that's fine, this position has always been kind of an in-training position that we bring in, and there's plenty of support through the state to go through the training in order to be successful in this role. So looking forward to that. I will tell you that we are experiencing what I thought, was kind of a fluid way to look at plans that come in the interim. I was using our engineering firm. The last variance we did though, review was a $2,000 review. I've got to call into them to tell them that we can't sustain that, and that how are we gonna do that. The other option that we may have is I've reached out to David Wilson, who has been remarkable in supporting staff when we have certain questions.
and whether or not, he would be interested in, assisting us, through a potential PSA if he were to go out and set up his own insurance and those kind of things. Obviously we can't employ him because he lives in Nebraska now. He did mention that he does have some capacity to do that, so these two variances, the level of review that they need, he could do quickly and easily and has done that in his capacity for years with the county. Trying to look at a way he could also provide support to this new member of staff, to just kind of help them with the training as well. So we've got it set up for the state training to be done for this onboarding of this position, but we'll be discussing this further with Candace too, whether or not, this is a viable approach, but we at least inquired, and there is some capacity and some interest in doing that, but explained to him that in this role, he would have to go out and set up, some, obviously we want them to be insured and it's just being a contracted service. So they were going to explore the possibility of that, and we would further discuss that with Candace. But certainly very capable, he holds the certifications, he holds the knowledge and expertise, and also the knowledge of the Lake County vernacular. So I think that he could be a resource and there's some interest. So we'll dive into that a little bit more though with Candace and whether there's any concerns about maybe further engagement on a short-term basis. And Kelsey too, because we have some input on that, so. And how long is the training with the state?
The training should be able to do, and maybe you'll recall, Kelsey, I think he went through just a couple months of training.
Yeah.
It's not a 6 month, it could be accomplished within 2 months.
Like 11 weeks, yeah.
And this is a really good time to do that because we're going into the summer, so the opportunities for shadowing other counties is there
Yeah.
now. Like if it was October, November, then we're starting to see not really being able to do some of that work. Exactly, and so I have also got a call into Summit County, that's who David shadowed. And then they even came for a couple of his inspections early on before he was kind of put out to do his own inspections without some mentoring.
Awesome.
So we've had that relationship with them in the past, so reaching out to explore if we can do that again. So we sent David to Summit and he worked with those crews out in the field for that experience, and then they came up and shadowed him a little bit on his first inspection. So we've set up that kind of, or at least communication pathway so far.
Any chance of contracting with them perhaps for the same kind of work that you might want to use David for? And the reason I ask is if he's in Kansas, it's a little bit more complicated and expensive to set up a company here in Colorado, since he doesn't live not here in Colorado to do that. So I didn't know if there'd be an opportunity to have some sort of an MOU or
We can
NDA with the
explore it.
other.
I think I'm gonna be pushing the envelope, just asking on capacity for this other piece, but we could look, we do have different sets of regulations, there's similarities of course, but we are two different sets, so we could ask if that support would be there. But I guess I just thought that we had contractors in other states, I know that employment is difficult.
Yeah, we do, but usually they're ones that have larger operations that the cost of setting them up here in Colorado makes sense for them. If it's just a one-off type of thing, that might be more challenging.
Sure,
So,
yeah.
but I'm just trying to anticipate if he's says, yeah, I'll do that, and then we start from the county attorney's office saying, well, you need to check all these boxes, he's like, oh, this is gonna be expensive, to do that.
Right. So we did talk about, what it would take to set up, a company and get the insurance that we would need to be
Right.
able, I said the insurance is the big piece. So look and see what that means, explore that if you do have an interest in whether it's viable or not. So
Right.
it may be cost prohibitive,
Right.
based on the return of the investment there, or, that it's a one-time thing, he's not actually looking to start a company. So it may be not an option, but we just attempt at least. So far, he's been super gracious when we have little asks to assist with things. I just feel bad about
And I'm paying for it.
Yeah. So we keep it to a minimum, and we are looking for that support from Summit. The wonky part kind of a little bit with the state is that Chuck retired, and who had really had, we'd established a really great rapport so we're working through our new contacts in the state. So we're having some transition
really great idea to explore if Summit would, be able to do these variants. For instance, the alternative OWTS looks for us.
Yeah.
So, because $2,000 is obviously cost prohibitive, both from a pass-through expense or a cafe expense. We can't continue to do these through the engineering company with NIFA that we had on board. So, the other question is, we would like, for these new variances, consideration in June. We don't need, we need to figure out what that hearing date would be just now, but fairly soon, because we do have to get notices out to adjacent property owners, in order to hold a public hearing on the variances. So, but that's a 15-day notification, so we were hoping for maybe establishing a time in June, and then we can work from there. So, I'm just asking for consideration for a date in June, and that coordination with them come and let us know when, or if we want to have a discussion on it, whichever's best.
We usually work with Sandra when we're scheduling, so we can see all three commissioners. So,
Then just make the request to Sandra and Candace.
especially without Andy here, like we have no idea what his schedule looks like.
He's gone a lot in June.
So
He could,
quorum would be 2, just like you voted.
Yeah, and he'll be participating as much online as possible,
yeah,
Okay.
but Sandra's the only one who can see it.
Yeah, that sounds great. I'll send the request over to Sandra and Candace
Thank
for
you.
a public hearing on the variances in June.
Thank you.
Well, then before we wrap up, as we are like relatively a new group here, is there anything else you all would like to see from Board of Health meetings? Is it helpful if we just prepare updates and like things that we need guidance on? I just wanna make sure it's the best use of everyone's time.
And quarterly meetings
yeah.
are still okay.
Matt?
quarterly meetings work for me, yeah, very interesting.
So can we set the next one?
We have to wait for Sandra.
Sorry.
But yes, I can get the ball rolling on the second one, the next one.
Yeah, for some reason it was not on my calendar today, so if we can just make sure that
Yeah,
everything.
I asked for it. Okay, yes,
So,
yes. Great.
Kelsey, how about before we 2026, when we get all of our community health assessment improvement, our new plan, could we get updates on the current plan? Like, hey, this is where we're at in terms of trying to tackle this priority and
Sure.
this priority.
This is gonna require a little bit of background.
Sure.
So the current plan is not public health specific.
Okay.
It was done in coordination with other community entities, which we do wanna get back to that. But what was produced was previously determined to not be what the group was looking for. So we have really just been putting out fires ever since I've worked here, so
Okay.
am I answering that did I answer the question?
You did, thank you so
Okay.
much.
Yeah.
Maybe next
But I
year we
imagine
could
in
do
every
that.
quarterly meeting.
We'll talk about
we'll
this,
have an
yes,
update.
yeah, but
Yeah.
no, we're not measuring our current work off of the past improvement plan.
Got it.
I'd be happy to review that if it feels like it would be a good use of time, but I would advise that we don't spend
Could
time
you
on
just
that.
send it to me? I'm just curious.
Yeah, it's actually on our website,
Oh,
it's
it's on our
called
website.
the Health and Happiness
Oh,
Plan.
yeah. Okay, that's what we're not working off of, but that's what was produced.
Yeah, I would say that a lot of our work is indirectly tied to that, but
Yeah.
it did not have, like I said, very measurable public health
Yeah.
actions in it, so
And that was produced largely by St. Vincent's.
yes.
Yeah.
So there was discussion years ago about kind of sharing the burden of that, and because of COVID and everything else, St. Vincent decided to take the lead.
Mhm.
But it was really not a workable document that the other entities needed.
Got it,
It
okay,
was just kind of to satisfy the requisite requirements.
got it.
There's a lot of tension surrounding what was produced.
I can feel it.
Yeah, I wasn't even involved in it, but somehow I have feelings about it also, so.
Well, I look forward to next year when we're
Yeah,
using
I'm
our
really
own
looking
plan.
forward to this one, and that's why we were very specific about the contractor we were working with, so that we end up with like measurable, a smart plan.
I like smart plans. Cool, thank you.
All set? Anything else?
Thank you.
It's 11:57 and this concludes the May 9th Board of Health quarterly meeting.
Thank you, Chair,
Thank
Vice
you.
Chair, Interim Chair. Thank you, Matt.
Vice.
Thank you, Vice Chair. I'm so odd not having Andy here.